Okay, so let's just take a quick look at a case study where functional neurological examinations play a really big role in what we do as somebody who performs acupuncture. So here's a quick case that I want to talk about and give you just a quick demo of what I did to really dig in and use functional neurology to help me as an acupuncturist really implement my acupuncture strategy. So I have a case of a 62-year-old female who comes in with chronic cervical pain and headaches. Headaches mostly affecting the temporal regions, but the pain was mostly on the left side of the neck. Now here's a case where the lady's been to a lot of practitioners in the past 4 or 5 years. She's been to a chiropractor numerous times. She's been to physical therapy in and out numerous times based on going back to her primary care physician, being re-prescribed physical therapy, but no long-lasting results. Okay, what I want you to do is with your eyes closed, go ahead and I want you to go to the left side, and when you get out to the left, I'll say return back to the center. And then when you come back to the center, I want you to say open, so we both know you're gonna open your eyes. And let's see where the light's at, okay? So go ahead out to your left. Okay, good. Now I want you to come back to the center and say open when you think you are back at the center.
Open.
Okay, open your eyes. You see how far off you are? Okay, so go ahead and fix it. Go back to the middle. Okay, close your eyes. Go back to the left one more time. All right, good. Now come back to the center and say open when you think you're back at the center.
Open.
Okay, you can see how far off you are, right? So go back to the middle. Okay, close your eyes and we're gonna go to the right side. Turn your head to the right. All right, come on back to the middle and say open when you think you're at the center.
Open.
Okay, so you're off a little bit there too, right? Not as much as the other side. Start the center, go back out. Okay, and come back to the middle. And say open when you think you're there. Okay, good job. Go ahead and keep your eyes open and you can take off the head device. So here you have a case where a patient's caught up in this chronic pain syndrome in the cervical region with headaches and nobody's been able to figure it out. She's also on medications. So what I'm gonna do is, you will see by using functional neurology that what I did is I used a technology, or what I would say is equipment, to help me really understand what's going on in her neck and brain. So as you can see in the video here, as I have the patient turning her head back from the right and from the left, going back into the center, you can see when I have her turn to the left side, coming back to the center, she is off target. In fact, you can see her go over the target much more on the right side. You also see her going over the target coming back from the left side as well. So based just solely on that exercise, which really gives me an understanding of neck proprioception and where the brain thinks the neck is in space, she has a overcorrection and she's not able to tell exactly where her head is in space. So if you can just step back and think about that for a second. So her brain is thinking her head is in one direction, maybe here, and to her brain, her head is straight. But the reality is her head is not straight, it's off a little bit. That by itself, if we really understand the neurological pathways and the integration that our muscles have to the spine and how all this interplay goes into the brain, it really makes a big difference as an acupuncturist on how we really treat the patient. So again, just by using that assessment with the laser, I was able to tell that in fact her cervical proprioception was not really good. And I use that to my advantage, again, knowing the pathways and knowing how all this integration occurs through the muscles and into the spinal cord, and then of course up into the brain. So then I went ahead and I implemented my acupuncture treatment and other strategies, neurological rehabilitation strategies, to really help re-establish connection between the neck and the brain to really get a balance of where the head is in space. And after I did that, guess what happened? Not only did the patient's neck proprioception get better, but the headaches went away and the neck range of motion increased much more, much better than it was when she initially came in, and her cervical pain diminished. And that's been for, I would say, the last month, maybe 6 weeks at this point, and there's no reoccurrence. So what I'm telling you is, by doing a functional neurology approach or looking at assessments from a functional neurological perspective, you can really understand how the neurology plays a role in the treatments that we perform on the patients for long-lasting results. But that's just one example of how we can use functional neurology in our assessments as acupuncturists to do a better job to really understand what's happening not only peripherally, but also centrally here in the brain and the spinal cord. Okay, now let's take a deeper look at this case where the patient had neck pain on the left-hand side but had bilateral temporal headaches. So I'd like to talk about the Neuro X Acupuncture approach to this patient's case. So that is, I used acupuncture, neurology, and I combined it with the technology right here, which is the head laser, to help me further assess this patient's case, but also to give me a really good idea of how I wanted to treat this person. So remember, this person had a overcorrection going to the right side. So somehow her brain was getting signals that was pulling her head more to the right. So based off of the laser assessment, that really validated my earlier assessments, and that really helped me to really deliver my treatment strategy in this case. So what did I do? So basically what I did is, because in my eyes, the right side of the neck was sending signals to the brain that was pulling the neck more to the right and pulling the head to the right. So I went ahead and I addressed the right side of the neck, and I used points like gallbladder 20, bladder 10, bladder 11, bladder 12, just on the right side. Now you may be thinking, why didn't I needle the left side? Because that's where the pain was. Well, because the proprioception was not really good in the cervical spine. And when I say proprioception, what I mean by that is the brain's perception or awareness of the body or the body part in space. So in this case, the cervical spine proprioception was pulling the head more to the right. That's what I needed to address, and that's what I needed to help fix. And so again, what I did in this case is I used the right side only acupuncture on that side. And in fact, I used electroacupuncture. And then after that, I had the patient use the very technology that I used to assess. I used this head laser to actually help reestablish good proprioception of the cervical spine to the brain. Did I just do that? No, I did other things. And one of the things I did in combination together was I did distal acupuncture. So those of you who practice distal acupuncture, I used distal acupuncture on the opposite side ankle on the bladder channel, like around bladder 60 area. And then at the same time, I had the patient sit with this head laser on and work different exercises that I show and I demonstrate in my classes and my courses to help reestablish that connection and that proprioception in the neck. And it's been now actually a few weeks after since I made that first video, and the patient's still no pain, no headaches, and she's about ready to be released from care here at my office. So remember, that's the Neuro X Acupuncture way of treating patients, and especially in this difficult to treat case where the neck pain was just really resistant on resolving the treatment. So contact me. You have my website address there, or you can call for a mentorship program, and I also have the residency available that you can see on my website, or I have a one-day intensive with different types of conditions like tremors and stroke and neuropathy and seizures, etc., etc. You can look those up on my website. But that's the Neuro X approach to this case.